2, 1. Please start, sir. We are live.
Good afternoon, everyone. On behalf of NASH 24/7, I welcome you to our public awareness program on busting the myths about fatty liver. NASH 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To speak on busting the myth about fatty liver, today we have a renowned gastroenterologist, Dr. N. Murugan from Chennai. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. N. Murugan is a leading gastroenterologist in Chennai, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has over a decade of experience building a clinical skill set that allows him to deliver patient-centric care. He is currently practicing as senior consultant liver physician at Apollo Hospitals, Chennai. On International NASH Day, we salute your dedication towards spreading awareness related to liver health and disease. So now I invite Dr. Murugan to enlighten us on the topic. Over to you, sir.
Thank you so much. And thank you to the Zydus 247, NASH 247 team for organizing this. I think it's a very important public awareness message because it is a very, very common problem. And the International NASH Day has been observed or created to spread awareness about this particular condition for the last 4 or 5 years. And we do our bit as doctors treating liver disease to create as much awareness as possible because we believe it is a very important area of healthcare that maybe has been underlooked in the larger fight against non-communicable diseases. So the disease I'm talking about is called fatty liver disease. It is very common and I'm sure almost all of you would have heard about it. Either you yourself have been diagnosed or you know someone who has been diagnosed because it is fairly common. And I'm going to talk a little bit about it, trying to clear some myths about fatty liver disease, which I hear from patients and public people I interact with. So I'm sure people listening in will have the same kind of doubts or misconceptions about fatty liver, and we hope to clear it today in this short interaction. Next slide, please. So fatty liver is simply the liver filling up with fat. Normally, less than 5% of liver cells will contain fat. That is on the left side, you can see a nice brown liver, and inside is a biopsy showing normal liver cells. On the right side of your screen, you see a swollen liver looking like slightly pale yellowish, whitish even. And if you look inside at the biopsy, a lot of white round globules are seen, which are all fat. So this is the liver which has excess fat in it. It starts to swell up and sometimes it can get damaged and cause problem. Many times the liver is able to work despite the fatty liver. So this is just to give you a visual impression how the liver will be once you or someone you know develop fatty liver. Next slide. So it is a very common problem like I mentioned. In India, there are many studies which show approximately 30% of Indians may have fatty liver. There is a slight difference in the urban-rural population. Urban population may have more fat, rural population may have less fat, maybe 40-30, something like that. We looked at our own data for the last 3 years and found that in patients coming to Apollo for a screening health checkup, and those who had ultrasound to diagnose fatty liver, approximately 38.6% of patients were found to have fatty liver. Mostly they were grade 1, which were considered as mild fatty liver. So this was our data, and this included a lot of urban and also some rural population who come to us for evaluation. So it is a fairly common problem. Next slide. So we can assume that every third Indian is likely to have a fatty liver, either currently or very soon. So it is a very, very common problem, and it's time the public understood this condition, how it can affect each individual and how you, and with the help of us, can overcome this problem. Next slide. So one of the myths is that liver problem means alcohol. This used to be more widespread, this conception, some years back, but now with more and more liver disease being diagnosed and liver transplantation being done, people understand that there is more to liver disease than just alcohol-related liver disease. Of course, drinking excess alcohol will increase fat in the liver and also cause liver damage, and some lose their lives over it. It can be quite disastrous, leading to liver failure. But there is more to the liver conditions and more to fatty liver than alcohol. And now in the last 20 years or so, we are seeing many patients who do not drink alcohol at all, many women even, who also develop fatty liver. Equally bad, maybe not as dramatic as alcohol-related fatty liver disease, but equally bad in its outcome. And we call this entity as non-alcoholic fatty liver disease. In colloquial term, when we talk to patients or when there is a public discussion, when we say fatty liver disease, we usually represent non-alcoholic fatty liver disease. If it is alcohol-related, we call it alcoholic liver disease or alcohol-related liver disease. So generally, when you hear the word fatty liver disease, it mostly relates to non-alcoholic fatty liver disease. There can be a combination where you have all the risk factors for fatty liver disease, such as obesity and so on, which I'll talk about, but also drink alcohol. So it depends on how much alcohol a person consumes. If the amount is fairly small, then it is unlikely to affect liver and cause damage. If the amount is excessive, especially people who drink regularly on a daily basis, large amounts, certainly alcohol plays a role, but you can have more than one risk factor. And we understand in liver disease that the more risk factors you have, the faster you will progress to liver damage and the more severe your disease will be. So it can be mixed etiology for liver disease. But generally, when we say fatty liver disease, it is considered in patients who don't drink alcohol or drink very occasionally. Next slide. So why do people get fatty liver? That will be the next question. So you said people who don't drink get fatty liver. So why do we get fatty liver? So over the years, it is now very clear that this fatty liver is mainly due to excess body weight or obesity, which is increasing in society across the world, including in India. And this occurs in people who consume excess food and calories and have a sedentary lifestyle. So this combination is what leads to increased body weight and obesity. Different people put on weight differently, and different people have different metabolic rates to maintain their body weight. So there are individual variations. But overall, if you eat too much and have a very sedentary lifestyle, you are likely to put on weight, especially as you grow older into middle age. And these are the patients who are likely to get fatty liver. The same group of patients may also have insulin resistance. Insulin is a very important hormone produced by the pancreas to clear the sugars and carbohydrates, which are bulk of what we eat, and convert it to energy and used by the cells in the correct way. But when there is excess fat in the body or there are other conditions that inhibit insulin action, you get this condition called insulin resistance. This also leads to type 2 diabetes, which is very, very common nowadays and increasing in number just as much as fatty liver. And obesity is part of all this. Maybe the first step in getting all the other problems. And obviously, once you have excess weight, all these conditions may coexist. Next slide. So now you have fatty liver, maybe you are overweight, maybe you have diabetes, you don't drink that much alcohol. Up to now, many people used to dismiss fatty liver as, oh, come on, everybody has fatty liver, what's the big deal? Even doctors sometimes tell their patients, oh, you have mild fatty liver, don't worry, it's nothing, everybody has it. Just, keep checking it now and then. And I do see many patients who come 10 years later with liver cirrhosis without realizing that in some patients, fatty liver can progress and damage the liver, and they need to check on it on a regular basis. Simply they haven't been told, or that awareness hasn't been there. We ourselves are realizing that this happens more and more frequently. So we always advise our patients differently. So is fatty liver dangerous? Yes and no. Those who have fatty liver usually have other conditions such as diabetes, high blood pressure, dyslipidemia, mainly high triglyceride, but also sometimes high cholesterol. And because of all this combination, they have a higher risk to develop heart disease and even some cancers. So this is the part that is not good, apart from the liver disease. And there is a condition called metabolic syndrome, which is a combination of central obesity, fat in the belly, high triglycerides, low HDL cholesterol, which is the good cholesterol that protects one from heart disease, high blood pressure, either pre-diabetes or diabetes. So this combination called metabolic syndrome is also strongly associated with fatty liver. And in those who have this metabolic syndrome, 2 out of 3, normally 1 out of 3 have fatty liver in the public. In this group of patients, 2 out of 3 may have fatty liver. So fatty liver is not dangerous in many patients for long periods of time, maybe even 10, 15, 20, 25 years. In some patients, it can be dangerous because of not only development of liver damage, but also development of heart disease, cancers, and so on. And in many patients over a period of 15, 20, 30 years, they are likely to get into problems unless something is done. So in the early part and majority, say 80%, it is not dangerous, but in the remaining, it can lead to problems. So one needs to be careful and monitor and take corrective measures to change this condition. Next slide. So this is why many people take fatty liver lightly, including some doctors, because the majority of persons with fatty liver remain well and have no symptoms. So I'm feeling fine. I went for a checkup. They told me I have mild fatty liver, but I feel fine. I have no problem. So why should I worry? This is the common response I get from patients. Of course, when they come with problems, this is what they've felt over the years, but suddenly now they have a problem. But a quarter of patients, maybe 20, 25%, can develop liver damage, apart from the heart disease and cancers I mentioned, and the diabetes, hypertension, and so on. Direct liver damage can occur in about 20 to 25% of patients among all those who have fatty liver. Next slide. So now we'll come to how fatty liver affects the liver. Again, this is something many people may not know because they simply think fatty liver is one condition and it affects the liver in one way. But there are different stages in fatty liver, and depending on which stage each patient is at, the health risks are different. So you can see the first stage is healthy liver. I hope you can see the pictures a little clearly. On the left side, then you come to fatty liver, where the liver gets slightly swollen and the color becomes paler. In this stage, it can be reversed back to normal if you take corrective measures. A further stage is called NASH, which is what we are creating awareness about today in the NASH Day. Because NASH means the liver starting to get damaged in a more severe way than simply having fatty liver. What happens is, due to a lot of reactions within the liver and outside the liver and the production of proteins called cytokines, you get a state of inflammation, that the body is not normal. During all this, the cytokines enter the liver and start damaging the liver cells. The liver cells start to get inflamed, damaged, scarred. And once they get damaged, the function of the liver starts to come down. So this first step, when this starts to happen, is called NASH. And NASH is the start of progressive liver disease. So once NASH starts, it will keep progressing and finally end up in this condition called cirrhosis, which is seen on the right side, where the whole liver becomes small, shrunken, scarred with a lot of nodules. And you can imagine how the liver on the left, the healthy liver, looks compared to the liver on the right, the cirrhosis liver. And naturally, such a damaged liver is not going to work normally. So liver has about 500 metabolic functions. So if it doesn't work normally, it is going to affect your health and perhaps your life as well. So this is how fatty liver progresses. So when you are diagnosed with fatty liver, you could be at any stage in the spectrum. So it's important for you to understand with your doctor's help at what stage you are, how badly it is affected, do you need treatment, what kind of treatment, how to follow up, what you can do to reverse it. So these are all the questions you should be asking yourself and your doctor. As you can see in the last column, the right-hand side, the cirrhosis is marked as irreversible. So once you get cirrhosis, you cannot revert it back to healthy liver. But in a stage before cirrhosis, when you have NASH and even NASH fibrosis, which is the early stage of cirrhosis, it can be reversed to a lower stage or even back to normal. So a lot can be done even at stages where the liver is already damaged. And this is why you need to be aware and take help as appropriately. Next slide. Unfortunately, a lot of patients who have NASH and cirrhosis also develop liver cancer. And fatty liver disease is now becoming an important cause of liver cancer across the world, including in India. Next slide. So there is a mortality associated with fatty liver. Mortality means death rate. So this is a beautiful study done in the US where they studied a large population for a period of 15 to 20 years and simply recorded the death in that population they studied over this period and noted what was the cause of death. And they related to the presence of fatty liver in these patients. So first they screened all of them for fatty liver, made a note of it. And then they didn't intervene, they just followed them up and recorded death over a period of time, over a 15-year period, and then published the studies, which gives us so much information about how fatty liver affects health. On the left-hand side is a kind of normal population without fatty liver at the time of entry into the study. And over a 15-year period, 15% of that group had passed away. Majority were due to cardiac disease and other conditions, which included cancers and so on, and strokes and so on. On the right, in the middle is patients with fatty liver. And you can see that the death rate increases from 15% to 27%, which is almost double. And you can find that still a large cause of death is the red, which is cardiovascular disease, and the green, which is other causes. There is a blue, which is slightly showing up in this group, which is liver-related death. So some patients with fatty liver disease started to die from liver-related death in this group. The third column is patients who already had NASH that were diagnosed on biopsy and other tests at the time of the study. And you can find that the death rate in this group is even higher, 38%. So from 15% in normal people to 38%. And you can see a lot of blue. So once you get NASH, a lot of liver-related death starts to occur. So what we can infer from this study is that simply having fatty liver and having NASH increases death rate in a community. And if you have NASH, you're more likely, not more likely, you'll have a higher incidence of liver-related death as well as other deaths. So fatty liver disease is a health parameter. It's a warning sign that something is wrong with the metabolic health of your body. And it gives you signal to take action. And it gives you a lot of time, perhaps 10, 15, 20 years to get things right. And if you get things right, you can avoid a lot of these problems. Next slide. So when you look at the natural history of fatty liver, again, this is a scientific study compiled using many studies. You can find, I'll just show you one part of this slide because it's a busy slide. If you look at NASH and then how it progressed to cirrhosis, it says 25% of patients with NASH will get cirrhosis over a 10-year period. So this is how the risks are for a patient, even if they have NASH. So only a good percentage, 25%, will progress to cirrhosis over 10 years. So you still have time to set things right. And the remaining 75% will progress slower. They may eventually get cirrhosis maybe over 20, 30 years. So you have time to take corrective action. This is the beauty about this condition and in many liver diseases, that it gives you time. And many times patients end up with cirrhosis because they don't heed the warning. And of course, in the past, this awareness was less. Many people didn't know how to check, what to do, how to take care of themselves in the context of liver disease. And they ended up coming with cirrhosis without going for checkups. Next slide. So I'll talk a little bit about NASH and fibrosis, because in fatty liver, there is a group of patients who have only fatty liver without liver damage. That is a starting point. Then they develop NASH, which is the inflammation, non-alcoholic steatohepatitis. That NASH then leads to scarring called fibrosis, and then excessive scarring or continued scarring leads to the final destination, which is cirrhosis. So NASH is a starting point for damage, and the development of fibrosis means that the disease is progressing, and from fibrosis to cirrhosis is a short jump. But even at the stage of fibrosis, patients can be improved, can be reversed, sometimes back to normal, other times back to a very low grade, and basically made healthier than they are at the present time. So like I mentioned, global prevalence of fatty liver may be around 25-30%. In this group of fatty liver patients, the prevalence of NASH will be 1.5 to 6.5% in the population. So it's a significant proportion of our population that may be having NASH. The strongest predictor for an individual patient that there will be a poor outcome and liver-related complications is the presence of fibrosis. So it becomes very important whenever we assess patients, either with fatty liver or in general screening, to know if they have liver fibrosis, because this is the starting point of accelerated liver damage, where we need to take action immediately. Next slide. So having said all this, let's come to some basic day-to-day tips. So now I've said all this, okay, maybe you have diabetes, maybe you're overweight, obesity. Now you want to know how to go about testing yourself. So what is the first thing you do to diagnose fatty liver? There are advanced tools, but the simplest, easiest, cheapest, widely available way to diagnose fatty liver is to get an ultrasound of the abdomen, which is available in every corner of India. And the doctor will be able to see if you have fatty liver. It is shown here as a bright white image on the left, and on the right, it's a little advanced fatty liver where there are some changes near the diaphragm, which you don't have to worry. So basically a bright echo, when the ultrasound doctor does ultrasound, will suggest that that person has increased fat. Normally it will be a little darker and grayer. The liver will look like that. So the simplest, easiest way to diagnose fatty liver is to get an ultrasound, which you can do very easily. This is the starting point. So to know whether you have fatty liver or not. Next slide. So there are a blood test called liver function test, which is commonly done. This test is more medical for the benefit of doctors, but I'll just briefly explain to you so that you understand how liver function tests are used by us. So you can see here, there is a horizontal line which suggests the average ALT in a group of patients that were studied. ALT is a type of liver blood test, which denotes whether there's any problem in the liver. So in a patient without much damage, the ALT is around 40. In a patient with some fibrosis, it is around just above 40. In a patient with advanced fibrosis, it is slightly lower. It is lower than 40. And in a patient with cirrhosis, it is even lower. So you can see that despite having a lot of damage and cirrhosis, the liver blood tests don't reflect that change. And sometimes it doesn't, at least in half the patients, it doesn't. In some patients at the early stage when they have NASH, the liver blood tests are abnormal. The SGPT or ALT is slightly high, maybe 2 times the normal. It gives the doctor a clue that there's some problem in the liver. And if they have fatty liver on ultrasound, then we treat that as fatty liver with NASH. But as you can see, even in advanced liver damage, where the liver gets damaged with fibrosis and cirrhosis, the LFT, HCOT, SGPT can be normal or slightly high. So it's very hard as a doctor to determine liver damage or the extent to which the liver is functioning based on just liver function tests. The reason I mention is that I know, and we have discussed this in our hospital, that many health checkups include only blood tests in their package. They do home blood assessment as like a general checkup or a mast cell checkup. So the patient gets a blood test done at home. They may be reported as normal or slightly elevated. They may show to a doctor, or they may just look at it themselves. And they tell themselves that, okay, I've done my muscle checkup, I've done all the blood, everything is fine. I have no problem. But a lot of things can be missed, not only in the liver, but in other organs as well. So we always recommend health checkup as a comprehensive package to tailor it to each individual. And Apollo is a pioneer in this kind of health checkups. We are now introduced a pro health checkup, which is a more advanced version of the health checkup, which is an individualized problem. So depending on what you come with, what is your background, your weight, your other comorbidities, what symptoms do you have, what assessment by the doctor shows. And then the tests are tailored to that so that we can pick up more abnormalities than simple blood tests. So while blood tests are good, it is not the only way to do health checkup and perhaps not the best way. So this is something I just wanted to share with the public so that we're talking about fatty liver now. So I've shown you ultrasound showing fatty liver, but the liver blood tests do help, but sometimes they don't help. So we have to put all in context, looking at a group of tests rather than just one single test. So the message from this slide is, if you do a liver function test, it is normal or slightly abnormal. That is good, but it doesn't mean that everything is okay. You may need more checkup to make sure your liver is working well or there is fatty liver. So this is the message from this slide. Next. So now I talked about NASH and NASH fibrosis as important steps in fatty liver disease before it progresses to advanced liver disease. So how do we diagnose this? Traditionally, till 5-6 years or even around 6 years back, the only way to diagnose all this would have been a liver biopsy. The traditional tests that we use, like ultrasound scan, blood test, CT scan, MRI, will not pick up this fibrosis or cirrhosis in the early stages. But in more advanced stages, when the patient is starting to get complications and the liver is getting more and more damaged, then it will pick up. But perhaps it is too late then. So how do we pick them up at a very early stage? So the patient has come to me for an assessment. He wants to know what is the stage of his liver. He has fatty liver. So we used to rely on biopsy, which is a painful, invasive test, which has complications. It is costly. It may need an admission in some situations. So it is not easy to do it regularly for patients with fatty liver. So thankfully, now we have a group of tests called non-invasive test of fibrosis. We call them NIT. And the most favored or the most widely used and the most accurate test in this group of tests is called FibroScan, which is shown in the picture. It looks like an ultrasound machine. It's a simple bedside test. Patient comes to the center. They lie down and the probe is placed. There are no needles involved and just a probe and some measurements are taken. Takes up to 10 to 15 minutes. And then you get instantly a reading. And with the reading, we can tell to a reasonable degree of accuracy, 90% accuracy, how much of fibrosis, is there any fibrosis or not, and to what level it is, and what does it mean for the patient. So this much of information we can give, which is extremely useful. And now many countries are adopting public health measures, including FibroScan in the screening, which means they go to communities or small groups where they can come for health checkups, find out any health issues. If they have something in the liver, they do a FibroScan as part of the assessment. So it's come to a basic level, almost like an ultrasound. So it's a very, very useful test, simple test to assess the liver health. Like you do ECG or echo for your heart, we do FibroScan for the liver. And this is a very easy, simple way to diagnose fibrosis. And then immediately you are alerted to your condition and it directs you to take appropriate help, see a doctor for prescription and so on. Next slide. There is another blood test which we use as a complementary test to FibroScan, which is called the FIB4 test. It's a simple blood test that any doctor can do using age, the AST level, ALT level, and platelet count. There is a calculation, and based on that, it gives you a prediction as to the likelihood of fibrosis. We recommend this as a screening test. So anybody who has fatty liver or may have other liver disease or they are suspecting they have liver disease can do this test based on simple blood tests. Either they can do it themselves or preferably with the help of a doctor, a family doctor or whomever they are seeing. Any specialist can do it. And if the FIB4 score shows a higher value, which suggests that the patient may have fibrosis, then they have to be directed to a center where they deal with liver disease, maybe for a fibroscan, and to see a specialist. So this is what we are recommending to the doctors as well to do in their practice on a more regular basis than they would now. Next slide. So like I mentioned, liver biopsy is the best way to diagnose NASH and fibrosis. Just the medical terms for you to understand, it may not be relevant to you, but NASH is diagnosed when there is steatosis of fat and there is inflammation, lobular or portal inflammation. These are different parts of the liver. Inflammation means some slight damage due to the fat reaction, and ballooning, the cells started to get swollen. So this combination is called NASH. And fibrosis is a repair for this damage which the liver undertakes, but it undertakes by just covering it with sheets of fibrosis, which don't function like a normal liver. So this fibrosis can also be seen on biopsy, but this can also now be diagnosed by these non-invasive tests like FibroScan. So though liver biopsy and histology is a gold standard test, the non-invasive tests are reasonably accurate. So we do biopsies very selectively when we're really stuck with a diagnosis, or we are thinking there is some other problem, or we don't know what the problem is. We want to know the extent of damage. But by and large, for diagnosing NASH and fibrosis, we now rely on non-invasive tests like the FibroScan. Next slide. So my final part of the talk will be how to treat or how to take care of this problem. So can fatty liver be treated? I talked so much about damage and so on. Can it be reversed? What are the solutions? Obviously, when I talk about the problem, I need to give you solutions. So the first thing is there are many treatments available for fatty liver. To understand the treatments, you have to understand the 4 stages. The first stage is just simple steatosis where there is fat without liver damage. The stage is okay, and patients will have to take it as a warning or an eye opener in a way to show that they have some problem and they need to take action. Second stage is NASH, where the inflammation starts, can be treated by medications. Third stage is fibrosis, which is picked up by FibroScan. Again, can be treated by medication and other changes. And the final stage is, of course, cirrhosis, which once it occurs cannot be reversed. But if you can maintain the function to even 50-60% of liver function, patient will remain healthy for many years. Only when they progress to liver failure and so on, then we have to think of other alternatives, like liver transplantation. So treatment really depends on the stage of the disease. So my recommendation is first you diagnose fatty liver, you determine which stage you are, and then you plan your treatment. The mainstay of treatment for all stages of fatty liver disease is change of lifestyle. In my first slide, I talked about being overweight and sedentary lifestyle and having a poor diet. This is the first thing you have to change. Medications are also now available in India to treat both fatty liver and NASH, and we are using it in practice. But remember, without lifestyle change, the effect of medication may be much lower. With lifestyle change, medications work extremely well, and the patients have huge benefit. We are seeing it in day-to-day practice. Next slide. So this is a pyramid system we use for treating fatty liver. At the bottom of the pyramid, covering all patients, is lifestyle modification. The next will be targeting components of the metabolic syndrome, like BP, controlling BP, controlling sugar, trying to control the central obesity, controlling dyslipidemia, cholesterol, triglyceride, and so on. And by doing that, we can improve the metabolic health of the patient and thereby help also fatty liver. The next stage of the pyramid, which is a smaller group of patients, is medicines for liver or liver-directed pharmacotherapy. These are specific medications designed for NASH patients at any stage. Even in cirrhosis, we can use it in selected patients. And final group in the top of the pyramid will be complications of cirrhosis like liver failure. Most of the time, we are now recommending liver transplant, but there are other complications that need to be managed. And that is what we do in specialized units, liver units across the country. Next slide. So the first step in lifestyle modification is weight reduction, because almost 70-80% of patients with fatty liver are likely to be overweight. In our country, overweight means a BMI of more than 23. BMI is a height weight calculation. Anybody can open it in the computer, put the height and weight, you will get a BMI. If your BMI is more than 23, you are overweight. So if you can reduce 5 to 10% of your weight, that is a good start and will have a lot of health benefits, both in fatty liver and in other conditions. Second is exercise. You need to remove the sedentary lifestyle and make it unsedentary. The recommended exercise is minimum of 150 minutes a week. You can do more, but a minimum of 150 minutes a week spread over 3 to 4 days. Not doing it all on one day and then doing nothing for 6 days. Spread it over 3 to 4 days. Doing yoga is good, but it is not exercise. Yoga is for mental health. It has a lot of health benefits, including good sleep, controlling your diet and so on, but it is still not exercise. So you need to do exercise, either aerobic type exercise or resistance strength training to build up muscle, or preferably both. Depending on your age and your physical fitness, you have to work it out. But the bottom line is 150 minutes of exercise per week. Third is the diet, which is an important component of lifestyle modification. If you're aiming to lose weight, you should reduce calories. Average adult will need 2000 or 2100 calories. You can reduce 500 calories per day, then within 3 months, you will start getting significant weight loss. It's not that difficult, but it needs a change in your mindset that you have to eat less, you have to watch what you eat, and that's a start. So low calorie, preferably low carbohydrate diet, because in India, we consume a lot of carbohydrates. Almost all the foods we eat have carbohydrates, whether it is rice, wheat-based products, maida, and so on. Bread, everything has carbohydrates. So we have to plan our diet so that the carbohydrate content is lower, moderate to high protein, and normal to low fat. So these are all just medical terms I'm throwing at you. It's very difficult for a normal person, or even for me, as I'm eating the food, to know, okay, how much fat is in there, how much protein is in that. The only way this will work is either you yourself sit and work out a diet plan by studying various websites, or join a food app where you can count your calories. It'll tell you how much protein, fat, etc. it contains. Or speak to a nutritionist, dietitian, get a diet plan for yourself. Everybody's diet varies. I may tell you eat 2 eggs a day, that is good protein, but you may not like eggs. I might tell you eat idlis, which is what we eat in South India. You may say, no, I like parathas. So it's very hard to prescribe one diet and say, okay, all of you follow this. Generally, these are the guidelines that will help your body and for fatty liver. So you have to make a plan, and you have to do it in an organized way. Whatever you choose, that's fine, but you have to make a plan, keeping these in mind. And my suggestion is, having done it for myself, for my family members, and for my patients, anything that is designed as a shortcut, easy method doesn't work. It may work for some time, but eventually it will fail and you will regain all the weight. Do something that is long-term and sustained, something that you can maintain on a regular basis without feeling deprived. If you go on crash diets, it's great for 1 or 2 months, but you will rebound. So please avoid shortcut methods or quick fix methods. Many programs are available in gyms and other places where they offer quick fix, like 20 kg in 3 months. They use maybe machines and other things to reduce fat. None of them are healthy or work for long periods of time. The best is to go on a sustained change in lifestyle, which is gradual. It takes 5-6 months to establish, but it can be maintained over longer periods of time. Next slide. So there's nothing called a fatty liver diet, but there are a lot of books on it. So you can read it if you want, and there are many websites that are available that gives you tips on fatty liver and diet. Next slide. In general, these are the kinds of food that you should avoid because they come under the processed food category, which are very, very high in calories. Not because they are bad. I mean, I'm not going to say, okay, avoid all this foreign influence and burgers and cola because this is not Indian. We have a lot of Indian food that have high calorie, like chaats, this nice bhaji that's in the picture. So it's basically processed food versus natural food, and drinks with a lot of sugar in them. And like a Lay's chips is a processed food. It has a lot of calories for each gram that you eat, much higher than normal food. So for example, if you take a bowl of fruits, it will have much lower calories. Or if you take nice cooked food at home with your dal, your rice, your vegetables, it'll have much lower calories than eating these kinds of food. So these kinds of foods are tasty. Maybe it's convenient. You go watch a movie, enjoy with friends, and then it's nice to eat all this. So it's become a cultural habit. And this is where the problem lies. Anything that's done occasionally is fine. So you can have a day or two where you want to eat this kind of food. But on a regular basis, you should try to eat natural, healthy food. So these are kind of foods to avoid. And the worst are the cool drinks, any kind of cool drink, whether it's a fruit juice or a Nannari or a Coke or a Miranda. Any cool drink or soft drink which has high sugar in it is bad for you, extremely bad for you. So try to avoid it completely. Next slide. There are so-called healthy foods, which are mainly green. You can see that I don't want to go through individual food, but most of them are green. So anything that is green is good for you. But obviously, it's not something like, okay, you just take broccoli, which is mentioned here, and every day you eat broccoli, your liver will be fine. It's not like that. It's healthier than eating junk food or processed food or high sugar food. But a balanced diet is always better. You need a little bit of fat, you need a little bit of carbohydrate, you need a little bit of protein. So a balanced diet. So that's why I mentioned that you should need to work it out with a dietitian or make your own plan or join a program or join an app to help you. Coffee, if you like coffee, it's good news because coffee has been found to reduce fibrosis in fatty liver disease. And 3 to 4 cups of coffee, anyway you take it, preferably without sugar, but anyway you take it, black, white, with milk, without milk, doesn't matter. Filter coffee, instant coffee, doesn't matter. But any coffee is good for you, for your liver. So 3 to 4 cups a day is good. Next slide. So the main culprit is the central obesity, which develops when you're overweight and obese, and when you have insulin resistance. It may even cause insulin resistance. So it's a simple, easy thing all of you can do. Just get the tape out and measure your waist at the navel area. And if it is more than 90 for men and 80 for women, then you are likely to have fatty liver disease. It also means that you have excess weight in your body and it's time to do something. And once your waist gets to below this level, then you achieved your target. It's a simple way to do it. And there are other ways to do like BMI and so on, but this is a simple way to do. So central obesity is a bad thing. So just look out for it and try to control it. Next slide. So there are many drugs that we use in fatty liver disease. There are drugs with weak evidence like vitamin E, diabetic drug called pioglitazone. Again, diabetic drugs called GLP-1 agonists or liraglutide. And another diabetic drug called SGLT2 inhibitor, dapagliflozin. And there are drugs with better evidence that they work in fatty liver disease. So one is saroglitazar, which is an Indian-made pharmaceutical product, which is very good for fatty liver disease and for NASH. And another drug called obeticholic acid, which is not fully approved, but we have started using in selected patients. So these are some of the medication under prescription that you can take for patients who have NASH and fibrosis, not necessarily for all fatty liver, but certainly with NASH and fibrosis. And there is some evidence that it helps the patients. Ideally should be combined with lifestyle changes and some weight reduction. It has a much stronger effect, but patients with liver damage will need these drugs to reverse it. Next slide. So I thought I put a slide on transplant, but it doesn't matter. So once patients with fatty liver develop liver cirrhosis and liver failure, then the only solution for them is a liver transplant, because that liver will not work for more than a few months. Liver transplant for fatty liver is increasing. I remember, say, 15, 20 years back, I started my practice in 2001. Not many transplants were done, but most of them were alcohol-related. A few were viral hepatitis. And in the last year or so, we see fatty liver as one of the commonest reasons for a liver transplant. And there's a good study from US which showed that in 2005, the number of patients with NASH going for transplant was only 5 to 6%, whereas now in the US, it is around 28 to 30%. Which is slightly lower than alcohol. So becoming just in day-to-day health, but also, previous slide, please. Can you go back one slide? Okay, keep it here. So NASH has become important not only for, no, go back to one slide and stay there. Yeah, no, next one. Okay, stay here. So NASH is important for important cause of liver disease, and also a lot of patients are coming with transplant. Whatever we are doing now will take some time to have an impact. So there are a lot of patients who already have cirrhosis who are coming with liver failure. So for the next several years, we're going to be treating them. But hopefully now we can start taking preventive measures to change the health of our nation and gradually control these lifestyle disorders or non-communicable disorders. Can you go back one more slide? I want to finish that. Okay. So my summary now is, in the treatment summary, diagnosing and staging fatty liver. You have to understand these different stages. The first stage is non-NASH or simple fatty liver. Second stage is NASH, then fibrosis and cirrhosis. And the fifth stage you can add is liver failure. So you not only have to stage them, then you have to treat the associated conditions like diabetes, hypertension, dyslipidemia, obesity. Then lifestyle changes, like I mentioned, are extremely important. All three components, weight, exercise, and diet, have to be taken care of. And there are medicines to help fatty liver. Next. There is a transplant. Sorry, this is the slide I was looking for. Patients with liver cirrhosis and liver decompensation, liver failure, should be considered for transplant. So now liver transplant can be done with a high rate of success, and many good centers or high volume centers will have a success rate of 95%. So this is extremely good and a huge progress from over in the last 10 years. Even long-term success of liver transplant for patients with fatty liver and cirrhosis is very good and similar to the other conditions. I didn't include a conclusion summary, so I'll just conclude my talk saying that fatty liver is an extremely common condition. It is part of the increasing trend in non-communicable diseases such as diabetes, heart disease, strokes, and cancer, which come from poor lifestyle, like I mentioned. And this is increasing due to the way we live. We just consume more food than we need to. We do less physical activity. With increasing digitization, this trend is worsening. We have food apps now to encourage eating. A lot of social activity revolves around meeting for food, whether it's a function at home, a wedding, a religious function, Diwali, Christmas, meeting friends, celebrating a birthday. Everything has food in it, and lots of food. And end of the day, we don't do much physical activity to burn the calories. So it just gets stored as fat. And the other thing is, many times we eat late in the evening or night, which is not the best time to eat, because a lot of the calories we consume are retained in the body, whereas if we eat more in the daytime, a lot of the calories we eat are consumed by the body and less are stored as excess fat. So a lot of things that we are doing now as part of the modern lifestyle is affecting our health. And we are shifting away from infectious diseases and malnutrition as cause of death now to these non-communicable diseases, which basically come from excess of food. So it's becoming a common disease, and fatty liver is one such disease which is not talked about much, but it is an important aspect of disease. And it may be a marker for poor metabolic health, which can lead to other diseases like heart disease and cancer. So it may be the first sign that your body's profile is changing. So it's an important thing to look out for and realize, okay, I have fatty liver and I have to take care of my health. How to take care of your health is to change your lifestyle as much as you can. Have a proper diet, have proper sleep, keep your weight down, do regular exercise, don't drink alcohol or take it in moderation. And basically that's it. And if you have fatty liver, take the right steps. First, find out if you have fatty liver, especially if you have high risk factors. Basically, if you're obese or your belly fat is high or you have diabetes, please check yourself for fatty liver. If you have fatty liver, try to stage it and see at what stage. You can ask for a FIB-4 score by yourself or with your doctor. If it is high, then look for other tests like a fibroscan. If it is not high, then take it as a warning and keep your health good. Do regular health checkups, maybe once a year at least, especially if you have fatty liver. And if you do have higher stages of fatty liver, seek help from a specialist. And our aim is not to, our aim is to help you to get back your liver health and avoid all these higher end treatments like liver transplant. So I will end with that, and whatever time we have left, we can do some interaction.
Right. Thank you, sir. Thank you for this enlightening talk. And this was really wonderful that we get to know about fatty liver this much. And now, with your permission, we will take some questions from our audience. So, can we take questions from the audience, sir? Hello.
I need to check, or you will check for me?
Yeah, I will let you know. So the first question that we have is that I don't consume alcohol. Can I get fatty liver?
Yeah, like I mentioned, if you have diabetes, if you're obese, and especially age group of 40 or more, then yes, you can get fatty liver. So the higher risk factors will be being overweight or obese, which is a BMI of 23 or more, having belly fat, which is a measurement of 90 for men, 80 for women, and having additional diseases, especially diabetes. So these are the risk factors. So if you have these risk factors, yes, you can get. My recommendation, if you have any of these risk factors, please get yourself checked out, not just for fatty liver, just do a health checkup, including an ultrasound. If you don't have these risk factors, you can just maintain the lifestyle, or if you are worried, you can just do a single time checkup. And if there's nothing, you can just carry on. But keep these three in mind: BMI, your belly fat, and whether you have high sugar or not.
Right. So this could be a case of non-alcoholic fatty liver disease, I think.
Correct.
Yeah. So the next question that we have is how I can avoid getting fatty liver.
Again, same thing. I think if instead of thinking too much, just maintain three things: maintain your sugar to normal, maintain your belly fat to less than 90 and 80, and maintain your BMI of 23, and do regular physical activity, have good rest. So that's all you need to do. If you do that, most of the metabolic health parameters will be controlled. Of course, no disease is 100% preventable, including fatty liver. So despite whatever you do, there are some who may get it, but the percentages will be really, really low. And it not only protects you from fatty liver, but also from other health parameters like cardiac disease, diabetes, even cancers are reduced. So maintaining a good, healthy lifestyle with 3 or 4 parameters in mind is good all around. So if you can do that, that is brilliant.
So we have one last question, sir. That what are the symptoms of fatty liver and when to visit a liver specialist?
So like I mentioned in one of my slides, there are usually no symptoms in the early stage of fatty liver, or at least no very specific symptom. Some patients say I feel some discomfort right on the right side, but it's very non-specific. So there are no real symptoms of early stages of fatty liver. Only when the liver cirrhosis occurs, patients start getting some complications. But in the early stages, no symptoms. So that's why we recommend screening tests to diagnose fatty liver. So if you have fatty liver, diagnose ultrasound, get your liver function test. If possible, do the FIB4 score test. If that is high, visit your specialist for fibroscan and other evaluation. If the FIB4 test is low, you can still consult someone to discuss what to do. But basically, it means there is no advanced liver damage. So you can do the simple lifestyle measures that I highlighted, and that should be enough.
Right. Thank you, sir. Thank you so much. So on the behalf of NASH 24/7, I thank Dr. Nataraj Murugan for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, it is also important for people affected by fatty liver to regularly visit the doctor and continue medications. With careful observation of precautions, it is possible to obtain control of the disease. I would also like to thank our audience for their active participation and patience in making this event successful. You may also share your suggestion so we can address them in our upcoming Facebook Live programs. So stay connected with NASH 24/7 on Facebook and take care of yourself and your family members. Thank you.